Hi everyone, Wynn Brown here with Jeannie, Sanborn, and Nolan from Infection Prevention, just to give everybody an update on some of the things going on in the hospitals and the practices and also in our community. I just want to kick off by talking about entrance control. We have entrance control at both of the hospitals, and we need to make sure that all of our staff are paying attention to that, stopping, pausing, checking in, getting a mask if they need it, letting everybody know whether they have any health symptoms or not, and then gelling into the facility. It's very important we have that done every day consistently. I know some people find it an inconvenience, but we're asking everyone to do it. And so I just ask you to continue to do that and move forward. So Jeannie, maybe you and Ann want to talk a little bit about your roles within the organizations to work on this as well?
Sure. Well, here at Heywood, we have a COVID unit where we put all our COVID positive patients and our suspect patients. We have all the necessary PPE that we need at this particular time. We have gowns, goggles, face shields. Part of the surveillance is to make sure that nursing and doctors, respiratory therapists, etc., all wear the personal protective equipment. We seem to be doing a very good job of that. We have plenty of pictures posted for you to take a look at how different we look these days with our masks and everything else. Again, most important is hand hygiene also. Ann?
At Athol, we continue to have PPE in our emergency department, and second floor is gearing up to perhaps take some convalescent care at Athol Hospital. And Heywood medical practices are open and receiving patients. It's really important that we continue to screen at all of the doors to make sure that there's no fever or other symptoms. And if those patients do have symptoms or staff, we encourage them to call their healthcare provider and or go to walk-in at Tully or urgent care at Heywood urgent care. Those are where we also have PPE and an excellent drive-up area where we can get tested and that sort of thing. The state is talking about antibody testing, and there's been a lot of questions about that, and there's really no good answers right now. So really what we're looking for is people who have symptoms of COVID or who have had direct contact with a positive patient without PPE, so not healthcare workers, but family members and that sort of thing. Those are the people who should get tested for the viral infection. But as far as antibodies, we don't know enough to give any sort of guidance. So you've probably heard a lot about that on TV, but no answers quite yet.
Okay, thank you.
And as we begin to open some of these practices, and we're doing opening in Massachusetts with different phases, it's so important to remember masks are still required, social distancing and hand hygiene. If we don't follow those rules, there certainly is the potential to have another surge with increased cases. So social distance when you go to the grocery store, everyone should have a mask on. You should stand in line 6 feet away. Follow the same precautions that we are doing right now as we begin with soft openings.
Thank you. What about our community sewers and masks that they're providing to us?
Yeah, so that's been a huge help, and thank you so much. We've had pediatric masks for pediatric patients to wear, as well as adult masks. The other day I saw one that had a big smile on the outside, so that was a lot of fun to see, and they've been very creative and stylish, so thank you very much. We've been wearing those, both healthcare workers who aren't on the front lines, as well as patients who come in here, and then sometimes they are able to have a mask so that they can wear it to Market Basket and those kinds of places. So thank you so much to all the sewers.
Well, thank you for the two of you for leading our infection prevention efforts along with Dr. Mohan. It's really been a great team effort in the midst of this pandemic. I want to thank everybody, especially as we bring Nursing Week and Hospital Week to a close, for the great work that folks are doing to make sure that we remain safe and our patients are safe. And let's just keep at it and know, especially at our main entrances, that we need to make sure that as we check in every day, that we pause and take the time to do that and make sure that we're in a good position to be a leader in our community around community health. So thank you all for your time today.